Imagine who was in the room in 1969, the White House Conference on Food and Nutrition under President Nixon, and the Secretary Butts oversaw the U.S. Department of Agriculture. Prior to that year, Dr. Martin Luther King Jr. and Robert Kennedy were assassinated, and the landmark civil rights legislation had just passed. The nation was grappling with widespread hunger in America, and chairing the conference was Dr. John Mayer, a leading nutrition scientist and president of my alma mater, Tufts University. The conference helped to shape the current U.S. food policy framework that we know now, along with expanding the National School Lunch Program, creating the National School Breakfast Program, as well as creating what we know as the Food Stamp Program, now called SNAP, and the Special Supplemental Program for women, infant, and children, and creating the nutrition labeling. From Anacostia to Atlanta, to Buffalo to Biloxi, to Cleveland to Compton, and Detroit to Dallas, our communities have not only been facing gun violence, but food apartheid. Crime to disease has been outpacing gun violence and has been the silent epidemic in communities. In addition, we have less than 2.7% Black nutritionist dietitians and less than 1.3% Black farmers. If this was a war, we don't have enough troops on the ground and resources and equipment to win this war. And food and nutrition security is national security. As a mom, a fourth-generation native of Oklahoma, I came into the field of nutrition and public health by taking my lived experience of seeing family members die from diet-related diseases like diabetes and heart disease and saying, this is not my heritage. From there, I came to Washington, D.C., living in the community of Anacostia that has not only faced a food apartheid, but a grocery gap and a stat of a 20-year difference in life expectancy between Southeast and Northwest Washington, D.C. And that fueled me to join the DC Food Policy Council, the USDA NARI Advisory Board, leading the Health Committee for NAACP DC branch, and now founding WANDA, Women Advancing Nutrition, Dietetics, and Agriculture. Because though the women make up more than half of our population, we don't even make up half of the leadership roles within the food and health system. And I thought, if we could only be the food sheroes that our community needs in educating, advocating, and innovating for a more inclusive, resilient, sustainable food and health system with an intersectional lens, where would our communities be? And so this is our defining moment. As the second conference by the White House on hunger, nutrition, and health convenes, we ask, will we have a seat at the table or simply be on the menu? I say, I dare not. We have a seat at the table, and we will build that table if we want to create the change that we want to see in our communities.